Hello, I'm Taniqua Broughton with the State of Black Arizona.
And I'm Shadi Tofik with March of Dimes.
The State of Black Arizona and March of Dimes have come together to launch this awareness campaign on Black maternal infant health in Arizona.
March of Dimes convenes the National Mom and Baby Action Network. We are dedicated to leading and facilitating change across policy, research, funding, and systems to promote health equity and improving the birthing experience for Black mothers.
By adopting the Mom and Baby Action Network's National Health Equity Framework, we aim to engage Black stakeholders and the community at large, establishing a common agenda and calling on Arizonans to take positive action for change. We like to express our heartfelt gratitude to our major sponsors and to those who generously funded and/or actively engaged in bringing this project to fruition. Your unwavering support is not only invaluable, but also instrumental in ensuring the success of our mission.
Please be sure to watch each video until the end for links and resources where you can contribute and take action. Your involvement makes all the difference. Together, we can achieve what we cannot achieve alone. Thank you.
We first have to be aware of those social determinants of health that oftentimes limit access to equitable care. So when we talk about the statistics in Black maternal health, we always bring up the fact that Black women are dying at higher rates, and oftentimes people think that it's a genetic or biological reason.
Race shouldn't make any difference. It's not biologic, it's not physiologic. There's no scientific reason why Black women should have poorer outcomes in pregnancy. So why then are we seeing differences across racial lines? History is the answer.
Many of the disparities that we see are dictated by social determinants of health, where people are born, play, grow up, where they work.
So there's all kinds of social determinants of health that put barriers in front of women in particular that make it more difficult to get that prenatal care that is so important to having a good birth outcome. Things like income, childcare, transportation, being able to take the time off work, making that appointment, and keeping that routine care.
The experience of living as a Black person in this country is very different than the experience of living as a white person in this country. Whether that is neighborhood, the food you have access to, it defies logic that we have places in our country where people can't go get fresh fruits and vegetables. Like, it sounds ridiculous to say it.
The Omnibus Act, if all are passed, will significantly lead to the greatest outcomes of improving healthcare, specifically Black mothers.
So I think the more that we eliminate these inequities in our country, the healthier women will be, and the less we have to worry about getting your first prenatal visit and making sure you come back for your postpartum visit.
We need upfront spending to keep people healthier. Our system needs to do much better with prevention, put the resources that we're using at the end of life at the beginning of life.
If these mothers don't have access to ensure that they have ongoing care, they're not going to be able to diagnose these conditions early. We as a society have to ensure that we're providing what we can do to prevent poor outcomes in the future.